Public health is the special source that is all around us, that is keeping us healthy on a day-to-day basis.
Essentially, it's about stopping bad things from happening, if you want to put it in its simplest possible terms.
Public health is prevention over cure.
Improving population health equitably.
Welcome to the first episode of Public Health Is, a podcast from the Public Health Association of Australia. We're the peak body for public health professionals and students.
In this podcast, we'll present a range of experts to discuss what they mean by public health. We'll bring in people who are at the forefront of public health policy to chat about the issues of the day, as well as perennial public health challenges.
I'm Paris Lord, Manager of Communication and Media at the Public Health Association.
And I'm Dr. Stephen Owen, Communications Officer here at the PHAA.
So what is public health? It's many things, but one definition is it's the art and science of preventing illness and promoting health by the organised efforts of society. Too long didn't read. Public health's about keeping well and stopping people from getting sick.
Some of these public health issues are global in scale, while some might be at the community or local level. What public health isn't, it isn't about health problems at the individual level. We tend to approach this from the broader perspective, the structural level, and focus on the industries which often profit from harms.
Public health's also about things like vaccine programs and monitoring the spread of infectious diseases. It's also education programs, for example, sexual health and well-being, or programs which educate the public about the dangers of smoking and vaping.
Public health is also about addressing health inequalities. It means identifying the parts of the population which are disadvantaged or are collectively more prone to particular poor health outcomes. Some of these factors are related to geography, socioeconomic circumstances, historical circumstances, or particular subcultural groups, and often there's overlaps between all of these.
For our first episode, we're joined by Adjunct Professor Terry Slevin, CEO of the Public Health Association, who'll give us a quick overview of public health here in Australia. Full disclosure, he's our boss.
Terry's adjunct professor within the National Drug Research Institute at Curtin University and adjunct professor in the College of Health and Medicine at the Australian National University. He has more than 30 years' experience in public health innovation, leadership and advocacy, and he has dozens of academic publications primarily focused on cancer prevention. So, Terry, thank you for joining us for the first episode of Public Health Is...
All good, and thanks. Good to be here and good to launch this podcast. PHAA hasn't leapt into the pointy end of podcasting. Clearly there's an enormous number of them in the zeitgeist these days. We do see it as an important opportunity to get into some of the nitty-gritty issues in public health, and as you've heard by the intro, rarely is a public health challenge simple.
So what's your view then of, or what is public health in your view?
Well, it starts with kind of language. Recently we heard the Treasurer come to the dispatch box and talk about his budget. And he talked about a big investment in the public health system. It's a turn of phrase we often hear. For the most part, that actually translates into investment in the hospital system. And that's the system that essentially we have to call upon when public health fails, when it doesn't work, whether it isn't done properly or invested in enough. Change of language that has been talked about a lot is calling public health population health. And that might give a better kind of insight. Essentially, it's about focusing on groups of people rather than individuals, whether that's, nations, whether it's local communities, whether it's defined geographically, or in other factors like age, gender, ethnicity, sexuality, etc. So we all identify in groups. Essentially, most public health efforts focus on groups. Maybe it's a focus on kids. Maybe it's a focus on older people. Maybe it's a focus on a particular ethnic group or people who behave in a similar way. So there's a lot that goes into tackling public health, but it really comes down to us organising community and society in a way that supports people being physically and mentally healthy and well. So essentially, it's about stopping bad things from happening, if you want to put it in its simplest possible terms. So it encapsulates an enormous range of things. We're familiar with immunising against infectious agents, and that became extraordinarily important through the COVID pandemic. But it is important through a whole range of other issues, measles, whooping cough, diphtheria, and many other such infectious diseases. But public health is also about having a healthy environment, whether it's healthy food, healthy water, healthy air, issues about climate change, the planet is heating up, and that increase in the heat that we're exposed to in the height of summer, and sometimes not even in the height of summer, is a challenge to the health and particularly of the most vulnerable people. Natural disasters, floods, famine, fires, etc. These are all fundamentally important underpinnings that are public health challenges. We've also got some of the things that people might classically think about with regard to public health. People who are essentially making money selling stuff that's doing our health harm. Tobacco, alcohol, junk food, gambling, and the list goes on. And we know what they are. And ultimately, there's a challenge for public health to push back against those who are profiting from things that are damaging our health. But there's also protection against things that we know contribute to or are carriers of disease. Vermin like rats and mice, and the Great Plague that really killed an enormous proportion of the population in Europe in the Middle Ages was very much about the uncontrolled presence and the disease brought by vermin, rats and mice. More recently, we think about, the extraordinary impact of mosquito-borne diseases, malaria, encephalitis and the like. But the other issue is diseases that we know can be spread through certain human behaviour. Sexuality is an example, so sexually transmitted diseases is another important area of public health. But it's not just about disease, it's also about injury. Public health has and should play a really important role in preventing injury. So classically, we've seen our roads and our motor vehicles get safer, and we work on safe cycling and then promoting, for example, physical activity through cycling, walking, running, swimming, whatever else, as both a form of transport and as a contribution to our health and well-being. Active physical activities are really fundamentally important and major driver of wellness, of health and disease prevention. But there's also stuff around safe workplaces. The union movement's focus on safe and healthy workplaces has been really important to public health and to improve the health outcomes for people in the workplaces. But also safety around backyard swimming pools and constraining or restricting kids' access by childproof fences. Also, injury prevention is really important on the things that cause enormous injury and death, things like gun control. That's another really important arm of public health. Stuff that people might not think so much about are things around discrimination, violence and racism. We've talked about the idea that if you are a member of society not feeling as though you're accepted, not feeling as though you are treated with respect, treated with equality, that has an enormous impact not only on your psychological and social well-being, but also flows on to your physical health as well. So that discrimination, whether it's based on your race, skin colour, religion, or any other determining factor, is an important underpinning in what's generally referred to as the kind of broader social determinants of health. And that encapsulates a whole range of other complex issues. Social determinants of health include circumstances such as our housing. Do we have a livable income? Those issues about acceptance and the way society operates. So all of it essentially boils down to that pretty simple notion, and that is trying to prevent bad things from happening to big groups of people. And often, if we do public health well, we can save lives or improve lives millions at a time.
So I think the answer to the question that our podcast poses, public health is, well, I think you've covered everything there, Terry. So I don't think there's anything that isn't public health by the sounds of that.
Well, it's funny you should say that, Stephen, because a good friend and a professor of public health at ANU has a talk which she calls Public Health is Everything. And so, when you think of it in that broader term, it kind of makes sense. Now, the classic language that the World Health Organization uses talks about public health is both the science and art of preventing disease and prolonging life and promoting health through organised community efforts. It's not about treating an individual illness, disease or injury. And the kind of conceptual pillars of those things come down to three things. Health protection, we talked about that in terms of environmental hazards, infectious diseases, workplace injuries and the like. Disease prevention, and that's stuff that's about eliminate elements of programs like vaccination and health screening programs, the type that finds disease at its earliest possible stage so the intervention can be successfully brought to bear before the disease gets too advanced. Also, public education campaigns and the kind of things that we classically might understand as public health. And the third one is about health promotion. That is, promoting people to be healthier for longer. And for me, it's not just about prolonging life. I mean, as we wrestle with the challenges of an ageing population, some people might say, well, is it really a good thing for humans to live longer? If we live to our 90s, over 100 and beyond, what's the quality of life like? And are we actually, through public health, generating more challenges, more costs and more burdens? That is, public health is about improving the quality of life, particularly in those later years. If we fail in public health, what that means to me is people in their 40s, 50s, 60s might be carrying a chronic and preventable disease, which reduces their quality of life. It reduces their capacity to contribute to the community. It reduces their capacity to function in paid work. It reduces their capacity to contribute to their family. It reduces their quality and enjoyment of their life and has an impact upon the people around them. So if we can do things in public health that forestall the inevitable, and let's not pretend we're all going to die one day. That's the simple reality of life. It comes to an end. But if we can put that off by 5 or 10 or 15 or 20 years, and at the same time ensure those additional 5, 10, 15 or 20 years are a high quality of life where we can see our grandchildren grow up and contribute to their education, training, well-being and care. If we can contribute to the community around us and help make the world around us a better place, for me, that's a genuine advancement, not only for the individual, but for the whole community.
Yeah, excellent. I want to bring us back to, I think you had a pretty good definition, and it kind of overlaps with something that my colleague Paris has said. Paris will often talk about public health being like a superpower or a protective force field against bad things happening. Terry, you've just said that public health is often about stopping or preventing bad things from happening to people. How does that come into conflict? That sort of suggests that maybe there's people who are less concerned about bad things happening to people. How does that come into play in public health?
Let's accept that everybody in society will have different views, different priorities, and take a version of what is or isn't good for society as a whole or the individual differently according to their circumstances. Now, if my paid job is at a local convenience store and 60% of my sales are sale of tobacco and another 20% is of junk food, then I'm going to want to be able to keep on making a living by selling those products. If I run a multinational tobacco company or an alcohol company, my core interest and what I'm paid to be responsible for is making money for that corporation. And that means maximising the sale of those things that we all know have an injurious effect on our health. So in those situations, whether I'm a corner store owner or whether I'm an executive in a big company selling unhealthy products, I'm always going to make the case that is best for the pursuit of that organisation, that company or that shop. And I'll make that case and I'll organise my arguments and my resources to prosecute that argument. And ultimately, the system of government that we have, democracy, is about getting those balances right. I mean, going back to Roman times, more than 2, 3, 4,000 years ago, there's records of arguments about the rules around how alcohol is managed. Very clearly, people who are intoxicated, whether it's in 2026 or 4,000 years before 2026, you drink too much, prospect of you being in or being involved in violence, essentially dying, accepting that alcohol in sufficient doses is absolutely a poison that can bring on death. People around see that. Now, whether the alcohol is wine or brewed or however it's generated, it can have those adverse effects. In small doses, a lot of people can enjoy and gain some relaxation and social cohesion at small doses of alcohol. So the challenge for the people who make the rules in society, and essentially if that's a dictatorship where one person does it or a small group of people do it, or a democracy where we all get to have a say, as a society we need to set the rules. We set the rules about where we can get access to alcohol, who should get access to alcohol. Should we allow 5-year-olds to get access to alcohol? Should we allow 10-year-olds? Should it be available around the clock? Should it be available on every street corner? Should we be able to buy it in any circumstances even if we're very, very clearly intoxicated and incapable of even being able to stand up. Now, time's gone by, all of those things have happened, and progressively societies have wrestled with the rules around the use of that addictive substance that is alcohol. So it's an example for me of the fact that humanity's wrestled with this stuff for a long time. There's always going to be new people wanting to sell new products and innovate and create new ways of making money, and there's many circumstances where that's a good thing. There's also circumstances where it's a bad thing. So the challenge for public health is to identify with sound evidence, using sound scientific principles and objective research and evidence to identify the things that are beneficial or harmful to health, and then recommend policies for the greater community and society to wrestle with to see if we can get the balance right. What's the best outcome? Accepting that underpinning all of that is a principle of freedom. We should be free to do the things that we want to do, and government should have as little impact upon our individual choices as is sensible and practical. And then the challenge is who defines what's sensible and who defines what's practical and who determines what the balance is. And for me, ultimately, that's what the role of government. So government is about distribution of collective resources, taxes and the funds we contribute to those collective benefits, whether it's clean water or roads or systems to help people who are least fortunate or able to look after themselves, and find a way of generating resources that can be distributed in a fair and equitable way across society. And the other part of government, not just distribution of resources, is to set the rules to determine what levers are in what place for what product and in what circumstances that gets the balance right. Now, there's always going to be a debate about that because there's always people going to come forward with new ideas as to how they can make a buck, how they can make things better. And we have to have a system in place of being able to, as objectively as we can, test those propositions and come to a set of rules, policies that maximises the benefit and minimises the harm.
How do you do that without the inevitable backlash of people saying, oh, you nanny status? I mean, we see it every time we share stuff on the socials of people should be allowed to buy what they want, whether it's illicit tobacco or alcohol, that sort of thing. What role is there, or how does the public health community counter these claims of our opponents that we're nanny status?
Sure. And that's, I've been called that and a whole lot worse through the course of my 40 years of working in public health. And I'm a bit beyond the name calling stuff. My wife occasionally likes to call me a fun buster. At the end of the day, we want to be able to go to a supermarket and buy a product and be confident it's not going to kill or harm us. Gone are the days where, on the back of the wagon that, goes from town to town, the elixir of life is being sold. And when we do the analysis of the product, it's containing a whole range of substances that could potentially kill us. Coca-Cola used to contain cocaine. We have an expectation that the things that we buy, food, clothing, the environments in which we live and work are safe and will give us the best chance of being healthy. We assume those things, and we assume governments will look after us in that regard. So I served on a thing called the National Industrial Chemicals Notification and Assessment Scheme. Doesn't roll off the tongue easily and got called NICNAS. All is to assess new chemicals coming into industrial systems in Australia to determine whether there were threats from those new chemicals that might result in harm. Now, you go into any cafe and ask people whether Australia should have a strong system to protect the community from new chemicals introduced into the environment or introduced into the food system or introduced into buildings. Pretty much everybody's going to say, yes, we should. Do people think we should monitor the quality of the air to ensure that the air is high quality? Do people expect the water that comes out of the tap to be clean enough for us to drink? The answer to all of those things is undeniably yes. So if that's the case, what's behind all of those things is science that tells us what is or isn't harmful, and ideally in what doses, and how we can ensure the most efficient and safe provision of the things that we need to survive. Air, water, food being three pretty good examples. So for me, the glib throwaway line of a nanny state's been thrown at me when I argued for smoke-free areas in indoor places, when I argued for smoke-free aircraft, Oh, but there's a smoking area and a non-smoking area. If you're worried about that, just sitting in a non-smoking area. Yeah, well, I mean, now we laugh at the prospect of a non-smoking area in a plane when there's this, one seat in front of us, someone's puffing away. So one of the things that struck me very recently in talking about this is, the radical ideas that we put forward in public health very quickly become just normal. And we think about that in terms of, removing the marketing of cigarette advertising, for example. We think of it in terms of having high standards in place for the quality of our food. We think of it in terms of any number of the things that are about keeping us safe and healthy. Sanitation's another great example. Much of the disease in the Middle Age came from the poor management of human waste. Now we expect sanitary circumstances so that sewage is managed in a proper and safe way that reduces the prospect of disease being spread through the mismanagement of that kind of waste. Pollution is a fundamental notion as well. We expect to have safe and healthy places to live, work and play, and we beat up on governments that don't deliver it.
I guess to that, we should also be aware that sometimes there'll be forces, sometimes politicians will say, oh, there's too much regulation, too much green tape. And that is often code for, I don't want to wear a seatbelt or I don't want a minute to monitor air quality anymore.
Well, and the red tape or green tape or the glib kind of turns of phrase that we often hear saying that we're over-regulated and society's become nanny status and all the rest of it, often starts with businesses who don't want controls in the way they function. There was a parliament not so long ago that had an annual cut red tape day. And on that day of the year, that particular government invited recommendations as to what existing rules should be set aside. And every time that comes up, the suggestions come from people who might have to meet additional standards in whatever it is they produce, having those standards reduced. And the question everyone should ask is, what happens if we do that? So if we take the lead out of petrol, for example, is that a cost in terms of the processing of fuel that fuels our motor vehicles? Probably is. What's the benefit of that? Taking the lead emissions that contribute to a whole range of chronic diseases. So for me, regulation is fundamental. People who argue against it will very often be the same people who will be horrified if certain standards are relaxed, which results in a harm to them or their family. So this is exactly the example of where the fundamental importance of democracy comes to the fore. These things are often not easy, and finding the right balance is always going to be contestable. But that's the job of governments. That's why they're elected. So my view has always been democracy is not a spectator sport. If you want to keep the protections that we've currently got, if you want to make it better to deal with the new threats and challenges, democratic system, government system, local, state or national, are the vehicles available for us to do that. Before we go forward and improve things, for example, if we actually want greater constraints on the preposterous marketing of gambling and bringing our kids into the realm of seeing gambling on sport as the only way in which we can enjoy sport, then we have to exhort our governments to do exactly that. Until we do so, the people who are making money out of all that gambling, whether they're multinational companies or local clubs with banks of poker machines, will continue to argue the case that they should be able to continue making that money. So these debates have to be had. They should be had out in the open where we can see them. We should be very clear about who's exercising what influence and how they're doing so, whether they're using money openly or surreptitiously, how they're mounting their arguments, and make a genuine and objective assessment of the validity of those arguments. And that should be influencing the policy making within society.
Yeah, I guess we're seeing that right now with the gambling debate and the government's let's say, somewhat delayed response to the Murphy report. And we often see the Prime Minister talking about getting the balance right. And that's something we've been talking about here is that balance of freedoms, individual freedoms versus, sort of the large scale protecting people from the harms. So it's probably a interesting word for the Prime Minister to throw around because it probably suggests something different to when we're talking about balance in this case.
Well, there's always going to be different points at which people think the balance is right, and those debates can and should go on, and they should go on in the public domain. We should be confident that all of the people contributing to that discussion have declared their interest. If there's money being made, then to what extent do we trust and believe the arguments being put forward by the tobacco industry when it comes to arguments about tobacco policy? We should put a filter across the arguments about alcohol when it comes from people from the alcohol industry. They've got clearly a financial interest in maximising sale of their product, but also asking politicians where their support comes for their election campaigns, what funding they get from what source, and that should be in the public domain. And happily, the Australian Electoral Commission does report on that on a regular basis. We could argue the detail and the frequency as to how those revelations are made, but we should understand those drivers of public policy and contribute to that discussion so as to get the best possible outcome.
So you'd acknowledge your vested interest in this, Terry, as a proponent of big public health and trying to use your influence to keep people healthy. How do you answer this?
I'm delighted to articulate my interest when it comes to public health. Career of 40 years has drawn upon public resources, whether it's the donated dollar when I worked for 24 years for a cancer charity, whether it's public funding through taxpayer funding, whether it's in my current role in a member-based organisation where my members pay me money for the privilege of doing more work for free that benefits other people. Members of the Public Health Association pay hard-earned dollars so that they can bring their expertise to the table, and they contribute to a number of the special interest groups that we have that focus on different areas of health. We have injury prevention special interest group. We've got, tobacco, alcohol and other drugs special interest group. We've got Indigenous health special interest groups. We contribute financially so that they can help to make the world healthier by drawing upon the expertise they develop. Half or more of the people at PHAA have or are studying for a PhD. So we focus on good food policy, not only food safety, but also trying to reduce chronic disease as a result of the promotion, consumption of unhealthy food. We've got an immunisation special interest group that is very much about the evidence about immunisation and encouraging uptake of proven and effective and safe vaccines. Child and health and youth health, those folks work obviously in terms of the best advantage for health for kids. And it may be the first 1,000 or 2,000 days, those really fundamentally important formative years. The people in injury prevention SIG might have a focus on road safety or, water safety or gun safety or whatever else it might be. So I'm delighted to articulate where our resources come from. And if those who want to argue against us want to call us big public health, well, good on them. They're spinning an argument and they're spinning a line in the public domain. Good on them. That's fine. Let's get down and have a real serious conversation about what's the best for the people of Australia.
Coming soon on Public Health Is.
I don't think the tobacco tax excise should be cut for the reason that even if the excise was cut, the illicit market would still be significantly cheaper than the regulated market. And so the financial incentive to choose between illicit or licit is not a non-event, especially given the challenges of cost of living we have at the moment.
That was Associate Professor Raglan Maddox, co-convener of the PHAA Alcohol, Tobacco and Other Drugs Special Interest Group.
It is my contention that illness prevention in Australia cannot be sustained without confronting racism. Illness prevention in Australia cannot be sustained without confronting settler colonialism, manifesting in racism as a fundamental driver of health for Indigenous peoples.
And that was Professor Ray Lovett, NHMRC Research Fellow with the Epidemiology for Policy and Practice Group at the National Centre for Epidemiology and Population Health, the Australian National University. He's also Associate Director of the Yadhura Walani Centre, which is also at the ANU.
But that's all we've got time for in this episode of Public Health Is. Adjunct Professor Terry Slevin, Chief Executive Public Health Association of Australia. Thanks for your time.
Thanks, Paris. Thanks, Stephen.
Public health is the special source.
Stopping bad things from happening.
Public health is the special source.
Stopping bad things from happening.